So a lot of you have been asking about the difference between the brown spots on the face and how can you tell whether it's a sunspot, whether it's a freckle or melasma or even anything else. So I thought I'll just give you a little whistle stop on how you can distinguish between the different brown spots on your face and what you can do to manage them. I'm not going to go into the treatment options into depth because I want to do a whole new video about just the treatment options that you can actually explore. My name is Balsam and I run a skin clinic, and a lot of the patients that I see tend to have some form or another of a pigmentation. So let's get into it. So let's start with the first one. So the first one is freckles. You can see the freckles, which are basically little cute little brown dots on the face that can be on the cheeks, on the forehead, sometimes even on the body. Now these tend to be expressed more, or they show more during the summer, so definitely sun has a big impact on them, but they also can be genetically linked, and you find that they can actually appear from childhood. So these are freckles. They're absolutely harmless and they're super cute. Some people don't like them. Personally, I think they're absolutely super cute. So the first one is freckles. Now the second one here is actually sunspots. Now sunspots are different than freckles because they tend to be slightly irregular in shape and they can also be larger. Now the difference between those is that they do not fade when the sun's not there. They're pretty much all year round, and they're mostly found in adulthood. So you don't really get a sunspot, or a liver spot sometimes they're called, and they don't actually appear when you're a child. They tend to be due to excess sun exposure over the years, and they tend to show. So sunspots or liver spots are completely different than freckles. Their shape is different, and also they don't disappear in the winter months, or they don't fade in the winter months. If you compare those to the slide below, these are not sunspots. They're completely different than sunspots. These are known as dermatosis papulosa nigra, and they are absolutely harmless, but they are depicted by raised dots or raised spots on the face, and they are totally harmless, but some people don't really like them and they want them removed, and they're absolutely fine to remove as long as you go and see a derm and they can do it for you. But the difference between those two, the sunspots tend to be more flat. They are flat, irregular in shape, whereas dermatosis papulosa nigra tends to be raised brown spots on the face. Now we come to the big one, which is actually melasma. So melasma is completely different. They are not freckles, they are not sunspots, they are not DPN. So they tend to be symmetrical in shape. So you tend to find them either on both cheeks or even on the upper lip, sometimes on the nose, the forehead as well. And it tends to be governed by different aspects such as trigger factors such as hormones, birth control, and also inflammation. Almost always the trigger factors for melasma is sun exposure and excess sun exposure. In fact, even a small 10 minutes of sun exposure can actually trigger melasma. So it's really important that you are protecting your skin from the sun rays, and also be mindful that you need to be protecting your skin indoors, because the high energy visible light that comes from your screens can also aggravate or trigger melasma. So that's why we advocate for the use of sunscreens that happen to be tinted, because tinted sunscreens have an extra protection. So with melasma, you will find that there are two types of melasma. There's epidermal melasma, which tends to be light in color with defined borders, whereas the dermal melasma tends to be quite deep, and it can be harder to treat and with blurry borders. So melasma is one of the most difficult skin conditions to treat. We cannot treat melasma. What we can do is create management options. If you don't protect your skin from the harmful rays of the sun and maintain it through good quality clinical grade skincare, then the likelihood that your melasma will return. So the treatment options for melasma tends to be very much geared towards targeting the pigment. So these can be the gold standard for melasma, which is hydroquinone, as well as you can use tretinoin, lightening agents such as tranexamic acid, azelaic acid. But just a word of warning when it comes to hydroquinone. Hydroquinone is an ingredient that's incredibly powerful at fading the pigmentation. However, it must not be used on a long-term basis because it can have serious side effects. So always remember, do make sure that you follow your prescriber's instructions when it comes to the use of hydroquinone, and to have those breaks in between to avoid the risk of side effects. There are modalities also for melasma treatments such as peels, and also such as laser modalities. So if you ever look in the mirror and thinking, what exactly is this brown spot on my face, this hopefully will help you to identify the differences between them. I hope that helps. Please share, follow and like if you want more videos like these, and save this video if you want to refer to it. Keep glowing and stay amazing.